You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, mini dental implants, replacing missing teeth with mini dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic, Dr. Joseph Gendler. Dr. Gendler, welcome to the program.
Thank you so much, and thank you for having me on the show.
Now, I understand you're a general dentist with a lot of training in dental implants, but who's coming in for dental implants? Like, who's a candidate?
We see a lot of patients. One type of patients are people who've been going to a dentist after dentist after a dentist, and they had lots of dental procedures done, and but they are still not happy. They cannot smile, and they cannot chew, and they are at the last course, and they are looking for solutions.
Okay.
So this is one atypical type of patient. Another atypical type of patient are people with dentures, people who had dentures for a while, for a long time, and they are not happy. They same thing. They cannot eat. They cannot smile. They are very conscious.
So a lot of people hate their dentures.
Oh my God, they hate their dentures. People like me and you, we take things for granted. A good teeth.
Yeah.
We can chew anything we want, and just imagine a person having a denture, this big piece of plastic in the mouth that is not attached to anything. It's freely floating in the mouth. You're supposed to eat with this. You're supposed to do a daily functions with these dentures. It's devastating for
just
people.
No good.
Oh my God, it's horrible.
So your goal then is to get these denture wearers, to get them in, and then to attach them to these mini implants, to lock them in.
Absolutely.
Full arch of teeth.
Absolutely. And there are a few ways of doing it. One easy way to do it, get this freely floating denture and attach them to a mini dental implants. Another group of people are people who have bad teeth and they've been told that they need dentures. And they don't want dentures, they want normal teeth. So they come to us for solution. They heard of a mini dental implants and they come to us for solution.
Okay.
Another group of people is that people with dentures or bad teeth, they've been to another centers and they've been given a very large estimates. It's physically, it's not affordable to them. So they come to us as a second opinion to see alternative with a mini dental
So your mini
implants.
implants to give people a full arch of teeth on the upper and lower.
Yes.
You say they're about half the cost of regular traditional implants.
Yes.
Is that right?
Absolutely.
But do they work?
Absolutely. Mini dental implants, they work great. As a study that came out, they followed 5,000 or more people, and they showed for a period of 10 years they work as good as traditional dental implants.
So the mini implants, almost the same effectiveness as regular?
Absolutely. A mini dental implants work as good as traditional dental implants. As a matter of fact, they are dental implants. They are just a smaller size.
Now, in your area where you are there a lot of people that are wearing dentures?
Oh.
Or about to get dentures?
Oh my God. In Minneapolis, St. Paul area, there are lots of thousands and thousands of people that are wearing dentures or heading towards dentures. And we have a brand new US Bank stadium. You can fill this stadium multiple times with people with dentures or people who are heading towards dentures.
So if these mini implants are so good, and they're affordable, you say,
yeah,
and they work, then why aren't these denture wearers all coming in to do this?
If people are wearing dentures, they don't go to a dentist on a regular basis. They are done of seeing a dentist. Just let me give you a life of person who had a denture. They've gone to a dentist after dentist, a specialist after a specialist, a failed root canals, a flaring out teeth, a bad breath, all this, a myriad of problems.
So people that have dentures went through a lot of problems first, is what you're saying?
Oh yes, they've gone through a lot. They've gone through multiple dental visits, they've gone through multiple expenses, but at the end, they got dentures and they are happy that they're out of this loop. They're going to a dentist.
So they don't
all
want to
the
go
time.
see you.
And last thing they want to do is they want to see me. They want to come to me. Occasionally, they do come to us to get a denture or fixed,
Or stabilized.
or realigned, or stabilized. But they go to a dentist and they don't know the options, and nobody tells them about the options. So that's why they don't know about options with a mini dental implants. They think that this is as good as it's going to get. So another thing why people don't go to a dentist, they start to self-diagnose. They start to think that they hear on TV that they do need a bone to hold the implants in. And with years, as we all know, bone starts to shrink, and there are chances that there is not enough bone.
But isn't it true if you've been wearing a denture for like 30 years or 20 years, you don't have enough bone to do this?
Yes, I agree with a statement that bone, it does shrink down, but for many dentists, yes, this is true. But for us, for our abilities, today's abilities of doing mini dental implants, it's not true. We can work with minimal amount of bone. Plus, on top of that, we do use a CAT scan. It's three-dimensional X-ray, and plus we use computer imaging. And with computer imaging, you can find available bone to place the implants in. And another thing that is for mini dental implants, you don't need lots of bone. You can use with minimal amounts of bone. In many cases, we can help to build bone with bone building materials. It's basically 99% of patients who come to us, yes, we do find help and solution.
Okay. How old can you be to do this?
You know what? There is no age limit.
What's your oldest patient?
My oldest patient is 92-year-old.
92 that got it? Dental implants?
Yes, one of my
mini implants?
Yes, one of my favorite patient. She came to us about 3 years ago. A very nice, a very sweet, a very active lady. So she had a denture for about 10 or 15 years. So she came to us and said, I can't live like this anymore. I can't eat. I can't go to a restaurant. I mean, I'm some kind of a limited diet. Please help me. And we were able to stabilize her denture with.
So you stabilized her denture,
Exactly.
like meaning snap in, snap
in,
out,
snap
okay.
in, snap out. A denture that snap in, and it stays in. It doesn't move. It's still a removable denture, but it works almost like your own teeth.
So you can eat and chew whatever?
Chew and eat whatever you want. You can snap it, eat into the apple. You can eat a corn on the cob. You can eat steak. You can eat a carrot. So you can eat anything you want.
We joked in the green room. You said, make your teeth great again.
Yes.
And your life great again.
Yes.
With these mini dental implants.
Yes.
Does it really, I mean, does it, look, with respect, I say, but you say it changes people's lives. It's just teeth. But it does change their lives?
Oh my God. Yeah, many people think that it's just a teeth, but when you meet a person the first time, the first thing you see is a smile, is teeth. And you kind of form your opinion about a person based on a smile. If something is wrong there, so you start to look at the smile all the time. And if teeth look great, you pass on.
Yeah.
People who don't have a smile, so they start to hide their smile because they
don't smile at all.
They don't smile. They kind of program their lip and muscles to hide the whole thing because they're embarrassed, and their whole personality it kind of goes inside. So
when you give them their teeth back,
yeah,
they're like transformed into a happier
it's completely
person.
I'll show you a few
Okay, let's take a look.
pictures
Let's take a quick
afterwards.
break, and we're going to go to these photos because I kind of flipped through them. They're pretty dramatic, and people need to know I'm not siding with you about these mini implants. I'm just asking you the questions, but they are dramatic. So
Yeah.
I would stay tuned for this next segment. You're watching the Wellness Hour. I'm Randy Alvarez. We're talking about replacing missing teeth with mini dental implants. We'll be right back.
He did a wonderful job on my mouth. I can finally, after years, I can eat corn on the cob. I can eat popcorn again. I mean, I can bite into an apple. I mean, there's so many things that you can eat that you couldn't eat before, and it sounds real funny to other people. And you have your life back, and you can do the simple things that you want to do. So, getting carrots, getting celery, raw cauliflower, and I mean, I loved all these things, but I couldn't eat them. So my advice is, have it done.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. My first guest, we're talking about helping denture wearers to get a set of teeth that are locked in, that snap in, snap out on the upper or lower, or people that are headed to dentures, and their only option is extractions and then get a denture. My first guest says nobody should be wearing a loose-fitting denture, that they should be attached to something. And in this case, mini implants. Lock in a full arch of teeth with mini implants. He says you can't be too old. You could even be a little bit unhealthy, a little bit of osteoporosis, and they can work with you. And they're about half the cost, according to Dr. Gendler, of traditional implants. Okay, so Dr. Gendler,
Hello.
you say people's lives change because you fix their teeth, and you said, let me show you these photos. So
Yes,
go
it's
ahead.
literally something that is changing people's lives. Let me show you a patient of mine.
Okay.
So she came in, and her complaint was that she cannot smile. She constantly has to hide her smile. She has to walk
She was embarrassed
her
of it?
lips. She was so embarrassed. She had to, many times, she had to stay home, and she wouldn't go out.
This is what she told you on the consult?
Yes.
Like they're that embarrassed. Interesting.
She's absolutely embarrassed. Her options were to get all the teeth out and get her a full upper and lower denture. Her other option was to get her stabilized with a mini dental implants, rock stable, and she chose to go with a mini dental
All right.
implants. A look at her now.
very nice.
Once she got her teeth done, it's completely a different person. She can just look at her face. It's not just a teeth, so she can smile. She doesn't need to hide her smile. It took her a while to reprogram her muscles and to
learn to
smile again, because people who don't smile, they kind of they learn to hide their smile,
Yeah.
and now they can open up a smile again. And with this whole transformation, her inner personality, it comes out. It's completely a different person.
We talked on the phone, and
Yeah.
you talked that teeth could change your appearance, but in this case, her teeth did change her appearance.
Yeah, it's
Very interesting how that happens. I mean, the before, the after, she looks different.
yeah. She was so proud of her new teeth. She changed her life. She's lost weight. She changed her hair style. So if you could see her before and after, two completely different.
Is that right?
Let me show you the next patient.
All right.
He came in, he's lost teeth many years ago. I believe he was a hockey player. So he's lost his teeth, and he cared a lot about his appearance, but
The way it looks.
the way it looks. But his biggest thing was that he told me, I wanna eat steak.
Okay.
I want to bite into a steak. By the way, when lots of people are coming in, and some they care about the smile, some care about ability to eat. But when we fix a smile, a benefit of smile, you get.
So this is a
ability to
guy
eat.
with those teeth, which you can hardly see. They had to be extracted.
All of them, they have to be extracted, and we gave him a same thing, snap in, snap out, and look at him after. He's completely different person.
Wow.
It's completely a different person. You know, he did not care about his smile as much. So one day he told me, he was at a grocery store, he smiled at the cashier, and she said, wow, you got a great teeth. And this was just such a great and positive experience to him. He learned to smile, he learned to show his teeth, and on top of this, it gave him ability to eat anything he wants, not to be unrestricted diet.
How soon can they eat after you give them these mini implants?
They can eat the same day. They can eat once we put the things in, and once we stabilize dentures, they can eat the same day. And I've seen story after story that finally they can bite into a piece of pizza or a piece of steak again.
Good.
And it happens the same or next day, and they cannot
Okay,
believe
good. We're
it.
going to take a quick break. We come back, more of your photos, before and after photos. You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants, and especially if you have a loose-fitting denture. He says he could give you mini implants and lock in a full arch of teeth. No more adhesive, and you could eat just about whatever you want. We'll be right back.
The best thing, people say, well, what's best about it? What did you like? What was it being able to eat food? Or I said the best thing is about a week after I got the teeth, and I've been practicing making sure I smile. I mean, I have to relearn how to do it. I walked into a store and two young women walked out, and I smiled at them, and they smiled back. And I mean, that doesn't happen when you've got bad teeth, because you don't smile like that. You kind of maybe give them a half grin, a little of that. And it's happened, it happens all the time now. You smile at people, they smile back. Suddenly you're in the human race again.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, mini dental implants. According to my first guest, he says that he's helping people every single day in his practice with loose-fitting dentures, stabilizing them, locking them in with a full arch of teeth supported by mini dental implants. With us, we have Dr. Gendler. Dr. Gendler, welcome back to the show.
Thank you so much.
You brought more photos.
Yes, but I'll show you more photos, but let me tell you a story about my beloved aunt. So,
Your aunt?
Yes,
Okay.
my aunt. So she had problems with her teeth for all her life. And a gum disease, a cavities, all the time, a visit after a visit to a dentist. Eventually, she came to a thing that she's lost all her teeth, and she had to have a dentures made. So, and this was basically before I became a dentist. So I remember one day we went to a joint trip to Europe, and over there in Europe you eat a bread, a crusty bread, you eat sausages, and she would just say, I'm not hungry. I don't want to eat.
So you're in Europe with your aunt, and
Yes.
she is making excuses why she can't eat things.
Absolutely.
Okay.
I was wondering what's going on. And she could not eat what she wanted to. Then her grandkids, one day she comes to a bathroom and sees that her grandkids, they play with her
With her denture.
dentures. And they say, Baba, what's going on? What are these things? And she was so embarrassed. Wow. And then another story. At her birthday, she was blowing up a candle and a denture came out, flew. And she said, that's it, that's enough. And at that time, I was practicing implant dentistry, so I got her fixed set of teeth that stay in, don't come in and out. And she came back. She was a completely different person. She started to smile again, and she did not have to hold reservations about eating or doing things.
So
or
they could
doing
eat whatever they want.
activities, anything she wanted. And I remember my aunt and my cousin, they came to me and said, thank you for bringing mom back.
You brought photos, and for the sake of
Yes.
time, and I'm not trying to rush you here.
Yes. So, I mean, this is
Oh my goodness.
another patient. Yeah, she came to us, and at consultation appointment, she said, you know what, I took care over years of my kids, my grandkids, my husband, and now it's time for me. I want to have a smile that I can be proud of. I can smile. I can do whatever I want. And she did not want a denture. She said the life is too good to have a denture.
All right.
So, and I looked at her teeth, and one thing that people with situations like this, they don't realize what kind of effect this kind of teeth have affect on the whole body.
Health. People like
It's
this,
disease.
this before, they have gum disease, right? So
Yes.
like what, bleeding gums? Like bad breath, things like that?
Bleeding gums, a bad breath, teeth that flare out, is becoming difficult to chew on these teeth.
So these teeth had to be removed.
All of these teeth, they have to be removed.
Yeah, but if you have bad gums, you could still do this, the mini implants? Even if you have bad gums?
Yes, of course. So it's common misconception that people with bad gums cannot have dental implants or mini dental implants, and that's why lots of people don't do it, because they've been told by other dentists and they've been told by medical. People with gum disease, these are ideal people to have a dental implants on. Once these bad teeth are out, so the gum disease is gone. And let
The
me
gums
give
get
you,
healthier
Yeah,
when they remove the teeth.
the gums get healthier. And let me give you an analogy. If you have a splinter in your finger, so it starts to bleed, it starts to get inflamed, you can clean around it, but infection is not gone until you get a splinter out. So a same
Same kind of
teeth,
thing.
Same kind of thing with bad teeth.
Is that her right there?
With-
Okay, so these teeth came out, you gave her like a snap in, snap
yes.
out.
And look at her now. Look
Very nice.
at her smile. Again, it changed her life. She could smile again. She could eat anything she wanted. I get hugs after hugs after
They
hugs.
hug you. The patients hug you.
Absolutely. You know what? One thing, if you do a crown or you do a root canal, you get a simple thank you. But for people like this, for people who change lives, they cannot stop hugging you.
Is that
so
right?
They love you so much. We had a story. We had a patient a few days ago, and once we were done with procedure, she looked into a mirror and she started to cry. Tears of joy and happiness. And she hugged me, she hugged everybody in the office, and this was just such a humbling experience for me and for
Very
everybody.
nice. So even though they're the mini implants, you could still make them the teeth that look real.
Absolutely.
That lock in.
Yes.
Snap in, snap out.
Yes.
Now, one more thing, because we need to mention this, that according to you, the way it's normally done is you do two people when you want to get these dental implants, mini implants. You go to one person that does the surgery and another person, another dentist, that puts the teeth on top. And then you send things out to a lab. At your office, you say you do it all right there.
Yes.
Is that right?
Yep.
You do both parts.
Yes. Yeah, I've seen this process over years. That a patient he has to go to imaging center to get a CAT scan done. Then he has to go to a surgeon to have implants placed into another place, and then there is another doctor who is placing a teeth. We think a difficulty of the process. We assemble the place that a whole thing is done into
All
one
done
place.
right there.
Everything is all done into one place. So
We're short on time.
can I please show you a few more pictures?
Okay, a couple more photos.
So
A minute left.
Yes, this is a patient. She came in with dementia like this. She hated, absolutely hated, and she was 92 years old. And this is her a picture after.
Wow.
So we were able to stabilize this.
So a snap in, snap
in,
out.
snap out. I mean, I was humbled to give this lady at least 10 or 20 years more of life.
Of chewing and things like that.
Ability to enjoy life again. These older people are very active, so they have lots of time. They do socialize a lot. They play bingo. They play with their kids and grandkids. So they want to live the same life as me and you do, and they want to be able to smile and eat and not to think about something is moving and not attached into the mouth. So let me show you another, a very strong. She came to me, she was a hairdresser, so she interacted with people all the time. Plus, she wanted to date, she wanted to meet people, but she had to always hide her smile, and this was holding her back. You know, and there
So
is-
this person had to have those teeth removed?
yes, she had
Couldn't
to
save
have,
them.
She had to have all these teeth removed, and we gave her fixed teeth that stayed permanently. And look at her now, a happy face,
Very nice.
a happy person. One thing that I want to share with you, if you have something that you don't like about yourself, it's called a self-image. It kind of is something that it holds you back. It handcuffs you.
All right.
But a good news is that once you remove this out, a personality comes back.
Once you give them a nice smile again.
Exactly.
So if you don't
They
like your
start to
smile,
shine again.
do something about it.
Exactly.
Nice.
So,
Now, we should mention, during the procedure, there's no pain, right?
no.
I mean, because you do a little bit of sedation. You also have another secret sauce you say that you use. You didn't say that, I said it. But some sort of a nasal spray
Yes, there are the few.
for pain.
Exactly. There are the few aspects. And number one, when you place a dental implants, there are no major nerve endings into the bone. And that's why you don't
So the bone
feel,
doesn't really have pain.
No, you don't
Okay.
feel lots of pain. On top of that, we do use sedation. As sedation, we do use both oral sedation when you give pills. We use IV sedation. And we do have a nurse anesthetist on staff who does routinely IV sedation. A new thing is that there is a spray anesthetic that you spray into your nose, and your whole upper arch, it gets numb, so numb that you don't need a shot
feel it.
many times. Let me show you another case. A patient, this lady, she had this kind of teeth, and she did not want a full upper or lower dentures. Here is what we did to her. We got her a mini dental implants and locked her teeth with these mini dental implants. And she's a happy camper again. She doesn't need to hide her smile. And she goes to a restaurant. She doesn't need to choose this meshy, soft food. She can eat anything she
So
wants.
we are out of time. But if somebody's watching this, right, and maybe their teeth all have to come out, or they're wearing a denture, and they've heard about mini implants, but they're skeptical, right? Like I'm skeptical. But they're afraid maybe of pain or whatever, or they think they're too old. What do you say to them? What's your final message to them?
You know what? It's okay, it's normal to be skeptical, but please come in to us for the consultations. Please talk to us, and we are confident that we can make your teeth and smile and life good again.
Okay, good. I want to thank you for coming on the show. Very nice.
Thank you.
And these photos are on your website. They can visit it there, find out more. And on the consultation, they get to see you.
Yes, they do get to see me. Yeah.
All right,
So,
thanks. You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.